and you're good to go. All right, welcome everybody. Thanks for staying back and hanging around. I'm Dr. Sage Wolfe, and I teach mainly the Wolfe non-surgical course. I do assist Daryl with like the whole life coaches sometimes, and just kind of travel around and do different trainings of the Wolfe non-surgical in different areas. So what I do, what you guys are going to be here for is like the Wolfe non-surgical course. I teach that like personally to families and friends and different clinics as well. So we do like, at the end of this course, once you are certified, I've had many people just teach their friends and family how to, because they have an idea. They know how to do the Wolfe non-surgical now. So they're going to teach their friends and family how to kind of do it so they can get worked on themselves. Because a lot of times when I find like a lot of practitioners or clients come out here to get trained, it's only one general family member and then they're kind of left hanging. And so when you go home, you are totally allowed to kind of teach people how to go in there with their elbow and slowly pull apart that tissue so you can kind of get relief yourself. Because doing the non-surgical over time, it is pretty debilitating on your body. If you're not in good condition, you're gonna notice your aches and pains. So when you are in my like Wolfe non-surgical class, especially prior to it. That's why prior to coming to the course, we always tell people to get on a perfect day diet. So do a perfect day consultation, see what works well with you, and start the detoxification then. Because normally when people just come on out and take the course as is, they do kind of realize that it is like a small like boot camp for your body to a degree. You're gonna end up really tender because we're releasing so much toxicity from the tissue. And then you're also doing a lot of physical work that you're not accustomed to. So it can be a little debilitating at the beginning. So just be mindful of where you're at. And if you do have stuff here to kind of like continue your detox journey, be really adamant about that prior to the course. Really do the pelvic squats, the belly button therapy, clapping to get into those areas that haven't had that stimulation in a long time. So like, what is Wolfe non-surgical? So Dr. Wolfe himself, he created this program about 35 years ago. And I've been doing this for about a decade now, just going on a little bit over, but I don't really kind of consist of when I learned it when I was really young, because I learned it the first time I took the course, I was 11 years old. And so I've technically been doing it for about like 15 years. But it's not, that hasn't been my main focus until I graduated high school. And then I went to a nutraceutical school in naturopathic school in Vancouver. I got certified as like a personal trainer just to learn more about the body, because you can do all the body work in the world. It does not matter. If you don't use that area and you're not activating it and doing some form of activity to strengthen the tendons and ligaments in the area and to keep the muscles healthy, they will start to atrophy. And so over time, as like, it's one of my favorite sayings, if you don't use it, you're gonna lose it. And that's with so many different clients and people that I see. They'll come on out and sure, their diets are on par, but they don't do anything for themselves anymore. They've lost the kind of love for life. They don't go they don't go biking, they don't go hiking with the family, they don't go back into nature. And that's why like gyms to like in this day and age are not really like my favorite thing, because we go there through intensity. I'm not really happy at the end of the day. I had all this stresses coming into my life, and so I'm gonna go to the gym in a sympathetic state. I'm angry as I'm trying to break down that tissue. I'm trying to lift as heavy as possible and get my mind off things, and that kind of is gonna end up debilitating the body. You can only get so far with that. That's why like we're working in a gym right now, and you can come in and see a lot of the elderly people limping into the gym just to come lift weights to see if that's going to, because you don't know what you don't know. And so all the power to them. I'm very happy that like they're trying, but trying and doing by like doing some inner work and looking at where your fall downs are and where you could be kind of really boosting up your personal body is not there. So they're not looking at the diet. They're not looking at rehydrating their muscle tissue. They're not looking at doing specific stretches to cater to a specific injury that they're having. And so they just come here, they work out, they tear down, and they actually create a more acidic environment. And so what happens with Wolfe non-surgical? So what happens with the body? Let's go into that first. So generally throughout our days, our bodies are not meant to live forever. I say that all the time. So my body's not meant to live forever. That's a given. And I'm going to go about my day thinking, and I need to be mindful of this. Like, what am I doing? How am I activating things? Depends on where you work. Like, do you work in construction? That's a very hard, laborious job. And some of those movements and some of those things can be damaging to the body. Some people work at a computer desk all day, and so they're very sedentary, and so they don't have a lot of movement. There's always going to be a weak link somewhere. And so for me, it's my knee. For you, it's your hip. And even if we had the same kind of job, we didn't have the same kind of lifestyle. We didn't have the same kind of mentality that was feeding these bad programs. So I go in and just say if I was like working hard at work and I have a very physically demanding job and I kind of tweak my back a little bit. So your body, and I make this analogy quite often because you go to the doctor as a kid and you break your arm. Most of the time the doctor is going to say, where he broke the arm or where she broke the leg is going to be stronger once it heals. That has to do with while you're like a young, fresh spirit, because not only did I break the leg, yeah, sure, it was like kind of scary and a traumatic situation when that happened, but I was safe because I was around my family who brought me to the hospital. They put a cast on. I'm getting excited because my friends are going to sign the cast. I might get a couple days off school. It's a whole experience in itself. And so that actually is like a fun experience for the child. And so generally, they're in a parasympathetic state. Sure, they were freaking out when it happened. So their body is releasing a little bit of that histamine, adrenaline, and cortisol. But how fast can we get into that parasympathetic state? So I'm with my friends, I'm with my mom, she's giving me comfort, I'm at the hospital, the doctor's joking around as they're putting the cast on, I'm thinking about going to school, my friends are gonna sign my cast. What a cool experience. So my body is still a fresh, young spirit, as I was saying. So I'm more in that parasympathetic state. I'm releasing happy, loving chemicals that heal my body. And that's going to be that, we call it our daily dose. Are you getting your daily dose? And that's going to be the dopamine, oxytocin, serotonin, and endorphins. And that is what heals the body. But now let's go a little bit older. I'm in my mid-20s, 30s, and I got injured at work, and now I can't go to work for the next little bit. I'm really pissed off because I'm more worried about my financial status. I'm angry that I'm debilitated. I go home, and so since I'm not really as mobile, I'm gonna start to order like fast foods and stuff that's really quick to put more poison into my body. So my body is not in a parasympathetic state when I get injured. And that happens for 99.9% of the population as we age. The injury wasn't an experience anymore. It's something that's debilitating that's gonna piss you off. And so now we're releasing chemicals and hormones that are going to be damaging to the body. And then we go into hack. And so like hack is going to be histamine, adrenaline, and cortisol. And that histamine, adrenaline, and cortisol, so we have healthy connective tissue here in general. So if I'm constantly tearing that healthy connective tissue by, it could be my laborious job, it could be too heavy of weights, it could be a physical injury. So from those things, we have all these micro tears. And so our body, generally to help heal an area, that's why even when you go to the gym or you go on a like avid hike or a run, the next day you feel sore in the area. That soreness is coming from that lactic and uric acid. So depending on how sore you are is going to depend on how healthy you are. You could get rid of that soreness a little bit quicker through hydrating more, getting more absorption from your water, from sprinkling certain minerals into your water like salt, taking a magnesium because we know everybody's low on magnesium, which relaxes the body. It helps rehydrate the tissues. And so I'm tearing that area, and I know my body's more in an acidic state. So I have lactic and uric acid coming in here and trying to bind things and kind of heal the tissue, but it makes you feel sore. That's not the problem. Lactic and uric acid is going to be in your body regardless. But the problem is you're all pissed off because you're not able to go do what you wanted to do. You're not getting the money coming in because you're having to take time off work. So now my body is releasing those negative hormones and chemicals, that histamine, adrenaline, and cortisol, and it actually binds that lactic and uric acid and starts to crystallize it. And as those crystals start to form, it starts choking off specific areas of tissue. So we call it scar tissue in general, but scar tissue is the umbrella that we're working with. So that lactic and uric acid is now binding due to that histamine, adrenaline, and cortisol, causing a crystalline buildup. That crystalline buildup creates plaque buildup within our arteries, creates lack of circulation within the muscle tissue, and getting flow to tendons and ligaments is a very difficult thing in general because the area needs to be oxidized really well and not have all these beaver dams blocked up all the way to it. And so we have that tissue buildup now kind of starting to crystallize. And now I don't realize, even though I healed, but I stayed pretty sedentary as I was healing because the doctor said, oh, don't move that area as it's healing at all, which is the number one thing not to do. We don't want to be in pain and be pushing my body while the stitches are healing or while the bone is healing. But do I want slight mobility? Do I want loving massaging going to the area? Do I want to be applying essential oils and different nice topical products like DMSO to stimulate circulation going there to help heal it quicker? Yes, it's just we're so indoctrinated to make it seem like the body is the most, and it is very complex. But if you simplify what makes you feel good and what makes you feel bad, life is going to be very easy going for you. But we're all so congested in our heads that I don't know what makes me feel good anymore. I don't know what makes me feel bad. So I kind of just do a little bit of everything. And that's where we kind of go into a whirlwind because you have no kind of program going for yourself. I'll hop back into the tissue though. So you've crystallized that tissue through lactic and uric acid and releasing those negative chemicals. Now I think I have the same range of mobility, but you don't. You are slightly limited because the muscle has dehydrated a little bit to kind of put that crystalline buildup there. And then you go to see you and have that same range of mobility, but you go to pull on something or move something and you are limited. So you're creating larger micro tears within the tissue to throw more crystalline buildup, which is that lactic and uric acid, through the histamine, adrenaline, and cortisol, and then you can have a massive scar tissue. So I can go in and feel into my upper back and trap area, and I should feel like muscles should feel malleable. They should feel soft, and they should feel smooth. Yes, you're going to have different fibers throughout the muscle belly, but it should feel like good connective tissue. But as I go to kind of feel into my trap, I'm feeling along this nice soft muscle, but I feel like I'm coming up to a little bump in here. And it is a good, well, generally when you come into the Wolfe non-surgical class, you're going to be learning about different body parts and structures of the way things are. And when we're dealing with people's bodies, we all have the same parts. We're just sitting slightly different. But generally over time, by doing the treatments over and over and repeating the body parts that we're working on, you get a really good general idea of where things should be sitting. And so over time, you're like, okay, I'm coming through that muscle, but why does it feel so hard about midway through the trap? It feels like his scapula is raised up there. That's not the actual scapula. You have the spine of the scapula, but you have scar tissue not hanging out on top of the scapula bone. Because where is scar tissue going to build up the most? On bone ledges. Because bone ledges and like in the joints, that's going to be where the tendons and ligaments are attaching and where the muscles are attaching. So for one, ligaments attach bone to bone and tendons will attach muscle to bone. And so we're gonna have this knot of scar tissue. And it doesn't feel completely like bone, but it is hard. But then let's continue down that pathway of unhealthy healing. And now I'm feeling in, and it literally just feels like a hardened mass, like bone on top of bone. And that can be like what the doctor sees in an x-ray. It's bone on bone. So within the knee itself in an x-ray, you still have some connective tissue in there. You still have some cartilage in there. But it has been it's been worn out a little bit, and it's been crushed down and compressed to where now when I look at the x-ray and we've overlapped calcium. And so I'll bounce back and forth from the neck to a knee. So if I was touching that neck and I felt like softer tissue, but over time I left it, but now I feel like there's a hard bone mass there. That's not bone. It's like when you look at somebody's foot and you see their toe jolting out or their toes starting to cramp in. That's not a natural thing to look at. I know like 15 to 20 years ago, I didn't have that hump there. And so what would that be? My body had to overlay because it said, hey, we created crystallization. We created scar tissue formation. We created fibrous tissue. You've left it alone for so long that our body kept overcompensating and laying down excess scar tissue and calcium to the area that it is now technically bone on bone. That is what we are seeing. That is what is visibly happening here, because you have created a bone on top of your bone. It doesn't mean that calcium can't go back into the bones, but it means you better be on a really perfect alkaline diet. It means that you are not stressing yourself and your family members out and allowing your family to stress you out. It means you are not dehydrating yourself and outputting more than you are inputting. And so are you getting your 2.5 to 3 liters of water a day to buffer down at least the acidity going into the muscles, joints, tendons, and ligaments? So it's a kind of a plethora of things that can happen with that. And so when we come down to a knee and that they see it's bone on bone, no, I've laid down so much excess calcium from the surrounding areas. And so people always ask, where is it taking that calcium from? There's only one place to truly take it from, because I know you're not getting a good form of calcium in your body, and you wouldn't just lay that down immediately. So if it's in my knee, I might be taking it from a bit of my tib and my fib, maybe from my femur. We're going to be going into the larger bone areas, and your body is so smart that it does this as a protective mechanism to save you. And so it's laying excess, so it's taking my calcium. So now, why is that one of the major causes of illnesses nowadays for like brittle bones? Osteopenia and osteoporosis. That wasn't a thing 80 years ago. So all of a sudden, as we age now, and it just came in that our bodies have to take our bone calcium. No, it's because we have such acidic lifestyles. We live in that sympathetic state, and that literally occurred 3 times a month 75 years ago. Now for the average person, it's happening 15 to 20 times a day. So it's like, oh my God, she freaked me out. Oh my God, he cut me off. Oh, that zit on my face. And like all these little things start playing a role to why you are not in a parasympathetic state. To saying, I need to take a step back. This situation is just too much for me. I need to go for a walk. I need to go drink some water, get into my breath, and then I'll come back and observe it. And I'll come back as more of a calm, general being, observing a situation and then going to react instead of just seeing what's happening and reacting immediately. And so that's going to be kind of the effect that happens with scar tissue being created. And so we can do that through anything. You just gotta not live in the present moment. And so for most of us, that is going to be a large factor to why our issues are becoming the issues in our tissues. Because it's what's happening externally first, and then we internalize it. If it's not emotionally, you're putting some crappy food in you, you're not hydrating well enough, and then your body has to take the job, because you know what? It knows that you don't love it enough. And so it's gonna say, I'm gonna try to save your life. So scar tissue is such a beautiful thing. It actually helps your body heal. And it helps many bodies heal, but it's the overcompensation that we have. And so that's one thing that can happen. And then we go into the emotional aspect of it. So how does emotion store into tissue? I can do anything. And so people can go through emotional trauma. I totally get that. There can be a traumatic situation. But people don't realize that now we talk about trauma like it's your next best friend. Oh, that was so traumatic. Oh, this was so traumatic. You know what's traumatizing? That girl who got bombed in Syria who has no family members tonight and not a house to sleep in. So that's trauma. We go through something called living life. How would life be for you if everything just came so easily? Everybody loved you all the time and you never had any enemies? No, not even enemies, just people thinking against the grain. Do you think life would really be that fun and enjoyable if it was just perfection 24/7? No, that's the whole point of this place. We're here to stress ourselves out a little bit. We're here to get that ailment, that disease, to see, are you able to rise to the occasion and say, no, I know that my spirit is infinite and I'm supposed to go through these trials and tribulations to see that this is going to make me who I know, like that essence inside. I'm a fortified being. I'm a beautiful essence of God. And so that must mean I am a part of God. So why don't you take that God-given right that you're here? That's 400 million to 1. Why do we flaunder it so lackadaisically? You're so special. And you don't need people to tell you that you're special. You are here. You woke up every morning. You have eyes, you can hear, you can taste. Do you have legs and arms that you can walk around? You're more blessed than 80 to 90% of the population out there. So stop giving out your ability to take on what you truly desire. No, I want to go be that, but my dad always said I wasn't good enough. So I just never really take the leap. You deserve it. And you guys are here, and that's a beautiful thing because you're taking the leap to learn more for your bodies. Because that's just it. If I'm not doing something for myself on a daily basis where I need to learn and grow in some way, sure, sometimes I take things a little too seriously. Sure, sometimes I'm a little hard on myself. Does that not mean I'm not worth it? No, it just means I need to kind of take a step back and observe sometimes because I push the envelope a little bit too hard. And I wear myself out. And that's okay, but it's making the realization of you're not okay, but you're here to do better. And so we're all not going to be okay all the time. And that is perfectly fine. And that's what I'm saying. It's about knowing in your power that with every low has to come a high afterwards. And with every high has to come a low. And I love the analogy of people being like, oh, why are my highs so highs and my lows so lows? I just want to hit that baseline. When you're looking at a heart monitor, what does baseline mean? You're not here anymore. So I never want to be in baseline because if I'm going shooting low, that means I need to do something to get up high. And if I'm rocking on a high, I know that maybe in the future there might be some bumps and lumps that I might have to get over. So you never want to hang out at that baseline. Just know if you're in a low, you're going to come out of it. But are you surrounding yourself around the environment that is healthy for you? So is it the right family members and friends that are boosting your motivation to continue being better? Or is it the same friends that are saying every single night, oh, let's go out for a drink, let's do this. You don't need to go to the gym today. You don't need to get out and exercise. Let's just have a lazy day. Like, do what's right for you and don't care about offending anybody. You don't want to go out there and hurt anybody. That's totally different. I'm not here to hurt anybody. But if you take offense from me loving myself first, you have the shit to work on, not me. But it's about being mindful of that and being so okay with you're not going to make everybody happy. You're not going to be able to please the world. And you're not going to constantly be happy yourself. But it's about snapping out of it and learning to stay in the moment and say, were you truly honoring yourself? That is just the main thing. Constant observation of was I truly honoring myself through that? Did I go to the gym today and did I work out in an angry state? I was working out because I was pissed off at my girlfriend. Well, why'd you do it? Should have went for a walk first. Should have taken a cold shower. Should have eaten a really healthy meal. Should have put some cayenne on your tongue. Do something. People always ask, like, how do I get out of an anxious state? Get uncomfortable. Getting uncomfortable will get you out of an anxious state any single time. So I tell people who get anxiety a lot, you should carry around a little packet of cayenne. Take a little bit of cayenne out of that, dip your finger on it, put it on your tongue. You're going to think about the spice immediately. It'll take you right out of that anxious state. If you're at home, I'm really anxious, go in a shower and make it so hot that you feel like your body is melting if you don't like cold. Other than that, for myself, I would prefer to go into a cold shock because I know that if I'm doing anywhere from like 8 to 11 minutes of cold therapy a week, there is nothing that will buffer down anxiety. There's nothing that will burn more calories and burn more visceral fat around your organs. And that will burn and it'll teach your body to go into that shock state, but learn to control yourself. And it's all about the power within you. And so what will you do when people come here to learn the Wolfe Non-Surgical? We try to teach you as much as we possibly can about the mentality part, but that's why we have the whole life coach at the beginning, because it's kind of a great prerequisite to go into the Wolfe Non-Surgical. It's not necessary. We don't say you have to do it, but it kind of gets your mind thinking on the right track. It kind of gets you ready for a solid diet, and maybe this is how I should be living opposed to this. Then when we come into the Wolfe Non-Surgical, we do everything when it comes down to the body, working from head to toe. We'll open up your occiput and the sutures along the skull. If you've had some traumatic concussions and that brain feels like you're getting like vertigo or you get migraines or major neck issues, We're going to show you that your skull is not one bone. It's comprised of 8 bones that slowly shift over time. So those lumps and bumps that you feel, those non-smooth curvatures that we have on the back of our heads, over time from stressing out and building all this up, we've created that tension to build up, which will now lay that excess calcium down. And so we go in and we open that up. Free up our minds. We'll go into the spine. I don't care if you have herniated, compressed discs. If you guys, majority of you were here for when Jack just showed up. He knew nothing about us. He knew nothing about us. He just saw that, like, we can help you prevent surgery. And you know what? Surgery is necessary in those emergency states. If you can walk and you're complaining about pain and you can still limp your way through the day, why the hell are you giving away a body part? The body part needs to go. If I get in a car accident and I've jolted my hip, like the head of my femur out of the socket and it's smashing up on my SI joint now, I don't even know what I would do with that. I couldn't even tell you how to begin to heal. I think, oh my gosh, doctors are so amazing in that state. If you've just kind of moseyed on through life, had this little injury, that little injury, and over time my body is getting debilitated. I'm feeling all these things starting to limit me. Why are we giving our parts up? There is so much that we can do to refurbish that joint. We can go into diet and mentality. Why are you living in an acidic environment? Okay, we change that environment. Now we're gonna go in with the non-surgical, and it will take multiple treatments. If any area is the hardest to clean out and refurbish, it's going to be the hips, because the head of the femur is so large in the socket of the trochanter that, like, it's really hard to get to that. That's one treatment that I'll always tell clients, if they're not willing to work hard at doing the pelvic activation squats, the clapping, doing stretches in themselves, activating the muscles, tendons, and ligaments around the area, and then us going in concession and doing the Wolfe non-surgical, the hip will not fully get refurbished. It is the toughest joint to do. Knees, shoulders, those are simplistic. That is something I can promise you, in one treatment, you will cancel your surgery. Hips, we need to be confident together. I need to have confidence in knowing what I'm going in and doing, and my client needs to be working their butt off to get that hip moving, because hips, for one, in an emotional aspect, it is, so in a physical aspect, I was saying, is it's going to be from the putrefaction from the large intestine. That is generally why hips will go out first, and that is one of the number one joint replacements, because here sits our large intestine, where that is the majority. If my immune system, over time, these drill bit predators start to rip holes in that peritoneal. And that's not the problem, guys. People are like, oh, but your peritoneal refurbishes within 7 days. But within those 7 days, did you eat really crappy? And then did it refurbish along the lining more bad bacteria, so it's getting stuck? So it's literally becoming just like a rotted out kind of intestinal sac. And that's what you're refurbishing constantly, because I wasn't just healthy for that one day. Then 3 days later, I had my beer again. 4 days later, I ate those bags of chips. That stuff can get stuck within the small and large intestine, hanging out in the peritoneal. And as I said, it refurbishes every 7 days. But if within those 7 days, you're not so mindful about cleaning out those pockets and everything else, and continuing making sure your bowels are moving properly, maybe doing some form of enemas to really get in there and flush that out, you're hiding bad bacteria still within that lining. So it's just constantly compounding that rot. And so now that we've rotted that out to that degree, that is now seeping out and affecting my other intestinal organs. And then it's going to be affecting my blood, and then the surrounding tissue and joints. So where is the largest tissue and joints that is coming off from my core area? That is going to be from the soup bowl, because we call it the soup bowl. That's your pelvis. Your hips and pelvis kind of shaped like a soup bowl. So that's where the large intestine over time can start to drop. That's why we get people being like, oh, I have a bit of prolapsus. That intestinal tract has gotten so weak that it has now fallen down, putrefied, seeped out. We call it pooping in your pelvis, and it's infected the blood and the tissues in the surrounding areas, that now my hips are literally inflamed due to the toxicity in my large intestine. Not just from like my daily walking or whatever. And if you have excess weight on your body, just know you're compounding that inflammation on the joints, because your body's only meant to carry around your natural weight, not the weight that you've created. And so at any given moment, the average person's body has 7 to 15 pounds of fecal waste within their intestinal tract. But that's the average person. What about the people with those excess bellies that you start to see hanging down and out? We can head into the 20 to 30 to even 40 pounds of inflammation and waste, because the intestinal tract is very long and it can get filled up, but it also can expand quite a bit. And then as it's expanding, that pressure's in there, causing more of the tearing, causing more of the seepage, causing more of that putrefaction to cause infection in the surrounding tissues, joints, and ligaments. And so that is why hip is a number one replacement today, because of the large intestine. And then also, are you having a hard time feeling planted in with where you're moving forward? Do you have a hard time of feeling fortified of where I stand? Do I know that like the body I'm in is as strong as it is? And this is a mental and emotional issue, because people are not sure of their next moving steps in their life. I'm not sure if I'm going to go that way or this way. And so then in that general situation, you're going to be playing these like little life failures. You're going to be downplaying yourself, and these negative emotions that I'm releasing actually get stored within that tissue as it's healing. So just per se, I was at soccer practice and sprained my ankle. It didn't break, I just sprained it, so I know I'm going to ice it a little bit tonight. And that is huge as well. If anybody has major issues and injuries, you can ice it right now. That is totally fine. I want you to ice it, but that is just because it happened right now. But if you're like, oh, my shoulder gets inflamed and it's been getting inflamed on and off for the past few years, don't ice it. That doesn't mean it needs ice. It means there's blockages around it, not causing proper blood flow and circulation and lymph flow to the area to restructure that tissue. So you can ice an area right after it's injured, but that's it. If you want to do some form of something that's great for it, you're going to do vascular flushing. That is my number one friend. So any kind of major joint inflammation, you're going to go into a shower or get your knee or wrist under a tap, and you're going to go extremely hot as you can handle without burning yourself, and you're going to hold that for about a minute. Then you're going to turn off that tap and you're going to go to as cold as you can tolerate, and go as cold as you can tolerate for about a minute. And you're going to go back and forth from each of those at least 4 times. And that causes the blood vessels to expand and contract and expand and contract, causing a flushing motion for the body. So it's going to help heal that tissue a lot quicker. Some people, and this one is really, really weird, but it's amazing. If you have a joint that is super inflamed, and if I have a client who's coming in and they want me to work on their knee, but I see that there's quite a bit of inflammation in it, and I don't want to work on that inflamed area immediately, I'm going to ask them to take a potato, organic potato, and you're going to slice up a potato, and you're going to put those slices around your knee and saran wrap that, and that's actually going to draw out the inflammation in it. And so that is another really like small, quick tip to help buffer down joint inflammation. So, but I want to go back to the emotional aspect of things. So you can go to soccer practice, you sprain your ankle at soccer practice. So Timmy goes home from soccer practice, he has the ice on it, and he's already sad about like he's not able to play in the next game and blah, blah, blah. And then his parents start getting in a fight that night. And his parents are fighting and he's hearing them scream, and that's kind of setting him off and making him feel really down. These kind of scary emotions and feelings that he's having in that moment are going to get stored within that tissue as it's healing. So then you go to get that work done, and it's 20 years down the road, and it's like making me really irritable and angry, and I just feel sensitive while it's happening. And I've had this many times. I'll have it with clients, I'll do an emotional release on them, and I'm not planning for the emotional release, it's a physical injury, because normally when you're going to work on an ankle or a knee, it's very different than when we're going to do like a heart release or a pelvic restoration or a breast restoration, because those are very nurturing areas of the body that will have more emotional issues attached to that in general. So we have areas that I mindfully know, like my TMJ. If somebody has major TMJ issues, they've never really had anything kind of going on in their life, I know that they've never really been vocal with what they've needed to say, or they hold in a lot of anger and they clench their jaw and I'm so pissed off all the time and life's just not right for me, and those emotions gonna get tied within that tissue because it's an inflamed area with an inflamed mentality, putting these two negatives together to kind of not create a positive at all. And so when I'm like, so Timmy kind of heard his parents fighting, that really set him off. I'm going to work on him now 20 years down the road, and he's so irritable, he's freaking out, and I'm hardly touching the area. It's not even physical at this point. And that's where we learn to become more mindful practitioners with our clients on the body parts that we're working. Is something setting them off? Is something kind of like, and you got to pick it up too, because your temperature can spike. You might start getting little chills. You might notice they're purging sweat immediately. If something really stinks, you start getting nauseous. The more in tune with yourself you are, the more you'll pick up in that treatment. And so he's freaking out, he's making noises, and I'm hardly touching him. And I'm like, hey, just take some breaths, try to breathe. And this is where we say try to breathe through the pain a little bit, because an area that I can be touching that has a lot of like emotional trauma in it, I can go into a physical injury and I will go 3 to 5 times deeper on that area, even if it is more sensitive. Like it's like I'm working on the face. I'll be putting more pressure here than I would be in a low back if they stored specific emotions in the low back, because their body is more hypersensitive. It's not wanting, the time that they felt that they were going through that trauma, they felt like it almost killed them. So now that you're working on it again and it's starting to resurface, to a degree, their subconscious is like, stay the hell away from me. Because if I go through this again, I might not make it. I don't know what I had to go through in the first time to create this, but I didn't like it, so I don't want to do it again. But this is where we as practitioners have to work and talk with our clients, say you got to get into your breath and really know that like you're in a safe space and know that you are full of love. You're an essence of God. You need to let this go through love and light. And within each breath, I feel like I'm getting lighter. I'm picking up those emotions and feelings. And a lot of times the client will tell you what it is. And sometimes they'll be like, I have no idea what it was. And that is totally fine as well. But then they got to go home and do some of the recall healing and see what is surfacing through them in that general area. So Wolfe Non-Surgical is physical for one. It is a very lovingly intense treatment, but I will push you. It is no Swedish massage. It's no chiropractics. And you know what? Chiropractics, people are always like, should I continue going to my chiropractor? I'm like, if you feel the need to. But the thing is, I think it's great to go to a chiropractor once, twice a year. Get put into alignment if you feel a little bit off. But why are we out of alignment in the first place? And that's why I say like Wolfe Non-Surgical, I'm not like, oh, it's the number one, you only need to take this course and no other body work in the world. I think other modalities are absolutely fantastic. But are we going in to remove these beaver dams, these major blockages that we've created on an emotional and physical level to create beautiful pathways, beautiful health within my arteries so the blood can move properly? And so it's really important to be mindful about your clients' diets while you're doing a lot of the Wolfe Non-Surgical too, because we're trying to increase that circulation. And here and there, guys, like I go to the gym, and I'm going to be honest with you, I go to the gym quite often, 5-6 days a week, depending on how I'm feeling. I do eat meat. It's always free-range organic beef, but I have more of like a whole plant-based and fresh and raw diet with a little bit of meat as well, because I can't output the energy I do and just survive off salads. It just doesn't work. And you can only eat so many lentils, chickpeas, and beans, and I love them, and I survive off that a lot. But here and there, it's called living life. Life is for the living, and I'm going to enjoy it. But I'm mindful about taking daily cleansing tea. Every 2 weeks, I'll do 2 to 3 days in a row of coffee enemas. I'm pretty adamant about what I put in here. So it is kind of like my temple, but it's my playground. It's not yours. So what works for me does not work for you. So if you're doing a lot of dietary stuff and you're doing a lot of non-surgical on a client, you really, even if they are a bodybuilder, or even if they are somebody who eats a lot of meat, you got to get them on the track that they shouldn't be having a high intake of meat while doing a lot of this work, getting this work done on themselves either. Because one meal of meat a day within a 24-hour span will slow your endothelial system down by 27%. That endothelial system is just the system that allows the blood to run through your arteries. And so if that's slowed down by 27%, think about the oxidization that's getting to my joints, ligaments, and tendons, to the area of my concern. And then that's not just it. I'm stressing myself out. I'm eating really crappy. Maybe I have other blockages in the surrounding area. Because if it comes down to the stuff in the lower legs, think about all the tracks that it has to go through and all the energy it has to get that blood and circulation and lymph flow out. Gravity pulls down. And yes, some people on there will say, yes, gravity is not a thing. It's called magnetism. I don't care. Whatever's holding me down here right now, I know has more of a pull towards below me than above. And so, like ankles, and see, this is why and I'll go into like surgeries and implants. You will see, I've seen so much rejection, like in my life through any surgery, it would be ankles because the weight of our body is on it. And that is because the body's putting our body weights there. And then either we have a little bit of excess body weight there. It's putting excess pressure on those joints with the screws and plates in there that you'll see more rejection over any other body part when it comes down to ankles. Knees, you'll see, they'll get it too sometimes, but a lot of times it's implanted into the knee itself. Not so much on the external part, but I have had a lot of clients, even with like screws starting to poke out specific spots on their knee, but you will catch it all the time. Like, and I mean all the time, when you do as much non-surgical as I have, I've seen it like over 50 to 100 times where people have to go get the screws taken out of their ankle because it's now poking like into their clothing, or they feel it catching on their sock a little bit, where it's pushing on the skin and they feel the actual screw protruding from where it was implanted. Because our body weight's pushing down, our body wants to reject it to a degree. You go to do it on a hip when they have full hip surgery, that's really not good. It's not going to get rejected so much there because it's within the socket. But you know what sucks is a lot of times they still use cobalt, and cobalt is what helps to create more systemic blood poisoning because of the toxicity within the actual cobalt itself. But when it comes down to the ankles, you'll see rejection all the times with that. We can work around the screws. We can relieve the scar tissue that's built up there, but I always tell them to go back into their doctor and ask them about getting it removed, and then we'll deal with the scar tissue afterwards if it's getting rejected. Same thing that happens with the abdomen. I'll see that a lot of times too because the body doesn't want it there, and it's not that it doesn't want it there anymore. The person's still living the same damn lifestyle that they were prior to the surgery, post-surgery. And so, you got to go for mesh because you have a hernia, and there's a lot of different types of hernias you can get. You can get inguinal, you can get hiatal hernias. There's a couple other little ones that you can get along your midline. I'm forgetting the name right now. But so a lot of times, somebody in your area, and this is for you guys online and for here, I don't care. Pay the money, find the guy. There's a doctor out there that'll still suture you up. They will do sutures, and that is the only way I would ever go if I had a hernia. If not, let's buffer down the inflammation, and you can live with a hernia, but if you're gonna live a very inflammatory lifestyle, you're gonna continue to push that tissue out through the abdominal cavity, it might get bigger. So if you're gonna change your lifestyle, buffer it down, there is ways to heal the tissue around the hernia. And the body wants to heal itself. We just don't give it the right environment. And so, just say you have an inguinal hernia, they wanna do mesh. Go for it. You're gonna get mesh done, they're gonna place it in you. It's going to choke off everything in the surrounding areas. So you're gonna have a cascade of different autoimmune issues down the road. I can promise you that. And now not only that, we have this blockade of a metal grate, a thin metal grate in there that's choking off surrounding areas and causing more putrefaction. But a lot of contraindications happen with mesh that I've seen. I've seen uncontrollable vaginal bleeding. I've seen more prolapsus afterwards. I've seen hernias in other areas of the tissue because they don't change their lifestyle. So that's the main thing. You're living in the same body, but now you're weakened, but you're still putting the same crap that caused it in the first place. It's gonna happen elsewhere. So it's like you keep that muddy wall and it's had this water bashing up against it for so long. You have a break in it somewhere and it's protruding and we have a leakage somewhere. We put fresh mud there, sure it's okay, but it's still weak in the surrounding areas. So it's gonna poke through somewhere else. So they're gonna end up having to either implant more mesh or do more stuff. I say don't spend the money, travel, find the doctor, go get sutures. I've also had clients though, I've only had this with 3 clients, so this isn't a super regular thing, but it happens. How crazy is that? So their abdomen, they don't change their diet, and so now their body knows it doesn't want that mesh in there anymore, so it actually starts getting rejected, and it comes to the surface, and it has poked through their skin, and it'll catch their clothes, and they have to trim these little metal wires coming through their skin. Makes no sense. Makes no sense. So, you know what doesn't make sense? How we're continuing to live in the same mindset with the mindset that I had that created the disease, the illness, the sickness. It's time to change. It's time to wake up. It's time to take your power back. And so we got to be mindful of what we're putting into our bodies. We got to be mindful that we're using our bodies. It is a beautiful thing. You're only going to get older, so you're only going to get slower. You're only going to get more stiff. So why are you choosing to stay stagnant, which caused it in the first place? Really just be mindful about who you are and know that you are a beautiful child of God, and don't flaunt that. So, do we have any questions here on like Wolfe non-surgical dietary stuff?
I'll just say really quick, I'm Dana.
Yeah, please chime in.
Well, I didn't want your information not to be heard, Dr. Sage, because it's amazing. And I'm a practitioner in Central North Carolina for Wolfe Non-Surgical. It's inside my small training gym that I have. I retired from professional bodybuilding in 2014. So everything he's talking about, from the emotional aspects of that to the physical aspects of that, is 100% on point. We're here at Beautiful Crunch Fitness with Kimberly and her beautiful business that she has here. But if I go out there now, inevitably we'll find people grunting, yelling, tossing a weight, taking some kind of supplement to make sure that their heart rate's up high enough to get their blood pumping. Even for myself years ago when I didn't know any better, you put on the heavy metal music, you're gonna go get, your wraps, do the heaviest weight you can push. What are you laughing at? You know it's true. Right. And when you're in it and you're all about it, you're like, yeah, this is it. This is what I have to do to become a professional bodybuilder. But it's not true. As I step away from it now, and after I retired, I came off of professional bodybuilding. I was quite sick. I had adrenal fatigue, I had thyroid issues going on, couldn't maintain good muscle contractions. There was a whole bunch of things. And even though maybe on the outside it looked fantastic, I had nice flat abs, 6-pack, walking around like looking great that way. But inside, probably if you took a little blood from me and looked at it, you probably would have thought I was 80 years old. It would probably look like some kind of goo in there. So there's the perception of what health looks like, right? And what it truly is. And that was what Dr. Sage, and that's why I didn't chime in. There were several times I wanted to say, because I see it every day. Most of my clients, when I started my practice about 2 years ago now, came from my gym. And years ago, before I knew about non-surgical, I would watch them and I'm like, oh, they'd complain, my knee hurts. And I'm like, well, as soon as you lose 50 pounds you need to lose, it'll probably go away, because I didn't know any different. They'd lose the weight, but guess what? Their knee problem was still there. And it's exactly what he was talking about. It was crystallization. It was calcification. Because calcium, when you have inflammation so long-standing like that, and the blood supply is not getting into the joint and into the tissues, ligaments, tendons, when it dries out like that, it stays in there, right? So it didn't matter if they lost the 50 pounds, it was still in there. It had to be opened back to the blood supply. I can't tell you how many times they would tell me, I'm doing yoga now to get my flexibility back. I'm like, yeah, good luck with that. You can't stretch beef jerky, right? You can't do it. And that's what happens to that tissue. That calcification comes because it's so inflamed for so long, your body sends calcium there to buffer that down, trying to buffer it down. But just like you talked about, it gets stuck in the tissue, like uric acid, lactic acid crystallized in there, right? Also, so did the calcium crystallize in there. So now you have that hardness. The additional thing that he was talking about are the emotions that were happening around that injury. How that happens, if you were listening to Dr. Wolfe for the last 4 or 5 days in our course, he's been talking about that we first create an image, right? Or see an image, either way. And then what do we have after the image? We have a thought, right? And what does the thought create? It creates an emotion. But what is the emotion? The emotion, and Dr. Wolfe was just talking about it, Dr. Sage was just talking about it, that when we create an emotion, and it actually has a chemical cascade that occurs, right? So if you are angry, you're gonna drop hack, right? Some histamine, adrenaline, cortisol into your system. It's gonna be your own little cocktail that you create to feel angry. His might be a little different from mine, but it's gonna be similar because we're human beings. So if I'm squatting and my wrap comes off and I feel like I tweak my knee when I'm squatting, and I get angry, I get frustrated, I'm kicking stuff, I'm throwing my weights around. Not going to say that I ever did that, but it could have happened once or twice. Okay. And when that happens, I create that emotion literally through a chemical cascade. It goes into my body. Where do you think that's going to go? It's going to go to one of my weakest areas already, right? So if I got a little knee problem, where's it going? It's going to settle into that knee. And then when I cool down, I'm going to have it crystallize right in there, right? So how do you get rid of that? That was always my question. I couldn't figure out why my clients or myself couldn't get rid of something like that, like a hardened joint like that. I was like, it seems like I could stretch it, it could work. When I was introduced to non-surgical, okay, I knew it was the answer to allowing the blood supply to come back there, become flexible again, become pliable again, and the lymph system too to clean it out so I don't end up, for example, he said the putrefaction. That's a awesome word, right, when you're talking about your own body. However, that's the truth. I see it in people all the time. My practice now has swung from having athletes in there to having people who are really, really struggling with health. And it always comes down to the large intestine. Almost always, like 98% of the time, I can draw it right back to their large intestine. So listen, that's why I didn't chime in. I wanted him to say what he's saying, because that's why we call it the most powerful body work in the world. Because it is.
Yeah, we're not knocking other modalities, but it's like, where are you wanting to start? And so what you should start with are the beaver dams that you've created, which is this crystallization, scar tissue, and calcification buildup. There's no other way to get rid of it. You'd have to go in very vigorously with clapping, one-shot therapy, gua sha stones, in concession with stretching. Your hydration's so perfect. You could do this stuff yourself. You really could. But we've gotten things to a point sometimes where it's so built up that you need to get some form of physical work in there. And so that's why we teach all around the world. I've taught in India, Hong Kong, Argentina. It doesn't matter. I've done all throughout North America. And we constantly are just seeing that people are coming to us, and it's totally fine. This is like, wake up whenever you want to wake up. That's great. But we're constantly training people and training all these lovely people who are already really sick, who are wanting to wake up. And the thing is, don't let yourself become sick already. Don't let yourself become so limited already. I want the younger generations to wake up too and say like, oh, I feel great already, but I could feel greater. So it's just about like taking those action steps. Are you being mindful of what you're putting into your body? Sure, your friends go out quite often, but why do you have to? Or why do you have to go out and drink every single time? Or why do you have to go out and indulge in the foods that they indulge in? Because it just takes one spark to ignite the way, and then other people do want to follow suit. Be the kind of guiding light for others, being like, wow, you look so amazing. Wow, the energy you have. Wow, you've slimmed down. And it's called just living a healthy, happy lifestyle for yourself. And so going in with Wolfe Non-Surgical is sometimes absolutely necessary. In severe cases, you can do a lot of this stuff yourself. And that's why the Doc of Detox, we try to teach you at Braveheart Nation how to become your own practitioner. Getting treated is great. Getting trained is the best. And so I'm going to be in many different places over the next few months. I have 2 weeks or 2.5 weeks of availabilities, 3 weeks of availabilities in November to do personal treatment and trainings or personal course certifications. So if you're interested in that, go to Braveheart Nation or give us a call to inquire about that. But check us out at braveheartnation.com. We're going to be starting off with Mexico next year in mid-January. That is probably one of my favorite places to train because you are able to eat the healthiest, best foods in a beautiful environment where you can go to the beach afterwards and do like salt scrubs and just go for like nice walks. And it's just like a very healing environment in general. So it's kind of like a vacation plus a training all in one. And then from there, we'll be heading to Melbourne, Australia, because we have a lot of Aussies who are loving the Wolfe Non-Surgical. And we used to come back out there pre-COVID. And then you guys kind of locked us out a little bit. Well, we got locked out. The world got locked out. And so we'll be coming back there in February. And then just check online to see where we're going to be at throughout the year. And maybe we'll be in your area. And come get trained, not treated. Don't be the majority of the population. Be the person who wants to heal and be the healer. And so it just takes one family member to light the way. And so do you have anything else to say?
Yeah, I think we have 2 spots left, I believe, starting on October 14 here in Bonita Springs. Do you still have them?
Yeah, we got 2 left right now.
Yeah, so we've got 2 training spots. You don't want to miss it because once they get full, once they're filled, that's it, right? They only take a certain amount. And it just takes 2 seconds. Get on the website, give them a call, and they'll get you all set there. Okay, there's still time to do that, so don't think you can't do that. The other thing I might mention too, if you're looking for non-surgical treatment by Dr. Sage, you definitely want to get on the phone right now because do you still have spots available?
Yeah, in November.
Okay.
November.
Yeah,
okay. So it's pretty much like all of November.
Yeah.
And I have if you're wanting non-surgical and you want to come experience it, you guys can give me a call on any of this right now on booking either a certification or booking a treatment because I'm always in a different area. If you have some questions about health or wellness, just give me a shout. So my number is, WhatsApp me. You can. I'm not so much on Telegram. I am on Telegram, but I don't check it as often. So it's best to WhatsApp me or just give me a call. It's +1 250 801 5673.
And I'm 315-360-2467, and I'm in Central North Carolina between Raleigh and Charlotte.
Beautiful. So next up, we got one of our pelvic girls coming on, and the pelvic girls are going to talk about pelvic restoration and why it's so necessary. And so that is going to more retain to the women on here. The pelvis is your holy grail. And yes, if you go to the gym and work out, we do everything for our external body to look so great externally. Why do we not focus ever internally? That is your holy grail. It is where you literally bring life into this world. It is an area that can be strengthened in mind, body, and spirit. Other than that, thank you for joining me, you guys. I hope you have a beautiful one, and we'll catch you in the next one.